This is blocking your spiritual awareness. It's not a lack of faith, not a failure of will, and not something someone else can fix for you from the outside. There is a pattern, a frequency, a structure that interferes with how you perceive the deeper, quieter layers of reality. And you can begin to check for it now, using only your breath and 3 simple, safe touches. If that sounds surprising, stay with me. In the next several minutes, I'll give you a concise map, a responsible historical frame, and a practical, embodiable way to verify whether this particular block is present for you. This is practical, not purely theoretical. You don't need permission from any institution to try it. If what I describe already rings true, type recognition in the comments so others can see they're not alone. A quick context before we do anything physical. What I'm about to describe draws on a set of ancient writings discovered in 1945 near Nag Hammadi, Egypt. Those manuscripts include texts like the Gospel of Philip and other writings that were preserved outside the shape of the later canonical collections. According to those Gnostic texts, there existed teachings meant to help a person recognize their spiritual origin. But those teachings were, over time, marginalized or suppressed by institutional structures. I'm not claiming those texts are the only source of truth, nor am I saying they are universally accepted doctrine. I'm simply offering them as one historical map, one set of language and images that help name a felt problem many people experience. An internal fog, a sense of being cut off from an original inner knowing. That map uses a few key terms. I'll explain them simply so you can use them as tools rather than traps. The monad, the word means the one, the primordial source, names what those writings call the originating light or original ground. The demiurge is a word these traditions use for a secondary creative force, an architect of the visible, often limited world. Think of it as the system that builds a convincing reality that keeps most attention on surfaces. Archontes, or archons, are described as patterns or intelligences that maintain that constructed field, the habits and interruptions that pull you away from deeper perception. These words are symbolic, whether you take them as literal beings, psychological patterns, or metaphors for social and psychic forces. They serve the same practical purpose. They identify a coherent set of disturbances that tend to block awareness. There's another label from the same tradition you may run into: pneumatic, or pneumatic beings. That simply means those who are of spirit, people whose primary identity is connected to that inner source. The writings speak of anamnesis, memory or remembrance. Awakening is first of all remembering who you are. If you prefer to see all this as poetic rather than literal, lean into it as a useful way to notice what you feel. If you're more inclined to the spiritual historical reading, take it as part of a living lineage. Either approach is fine. The practice that follows is about what you experience in your body, which is accessible to both. A crucial framing before we proceed. The thing that blocks awareness often works by creating noise, intrusive thoughts, confusion, subtle doubts, a pulling of the mind toward judgment rather than noticing. That noise isn't merely accidental. It acts like a tuned interference that keeps the deeper senses focused outward or anxious. The method I'll guide you through is simple. It helps you find physical markers in your own body that, according to these texts and to the reports of many who have tried such practices, often correlate with greater clarity of perception. You're not being asked to believe, you're being invited to notice. Safety first. Do not perform anything that feels painful. Use only light touch with your fingertips. Do not press hard or massage. If you have a medical condition, neck issues, or are pregnant, take extra care and consider skipping any palpation that concerns you. This is an experiential practice, not medical or psychological treatment. If at any point you feel dizzy, distressed, or unwell, stop and seek appropriate professional care. Let's begin with a simple centering. Breathe in slowly through your nose, letting your belly soften. Exhale with equal gentleness through your mouth. One more breath like that, long and settling. Feel the contact of your feet against the floor, the weight of your body in the chair or on the ground. Soften your jaw and allow your shoulders to drop. There's nothing to achieve here except noticing. The test I'm going to guide you through examines 3 places. For each place, we'll use a light, exploratory touch and a quiet, attentive awareness. The 3 locations are the base of the skull, the outer edge of the hand between the little finger and the wrist, and the upper center of the chest, the externum. Think of them as 3 tiny windows. One for origin, one for perception, one for command. You may feel something subtle, a texture, a line, a warmth, a stillness. You may feel nothing at all. Both are valid results. Many people report different sensations in each place. Some report none. The point is to learn how your body communicates to you. First location, the base of the skull. Gently bring your fingertips to the place where the back of your skull meets the top of your neck. Use no force. Just rest the pads of 1 or 2 fingers there. Notice the texture of the tissue, the angle of the bone, any subtle hollows or ridges. For some people, this area feels smooth. For others, there may be a tiny depression or a line of tension. Take 3 breaths as you keep your touch light. Breathe in and out. If any discomfort arises, remove your hand and simply notice the breath. For many who are described as having a connection to origin, remember, this language comes from certain Gnostic texts. This area can feel like a quiet marker, a place of soft differentiation between head and neck. It's subtle. There is no expected dramatic sensation. You might notice a sense of recognition, a small loosening, or even an odd numbness. That numbness does not mean absence. It may mean the sensation is delicate. Now slowly lift your hand and rest it on your lap. Take a breath and name to yourself what you noticed. Was there a difference in texture or tension? Did any image or memory surface? Write that down mentally. You are collecting data, not conclusions. Second location, the lateral side of the hand, roughly between the little finger and the wrist. Bring your opposite hand to the outside edge of the non-dominant hand, the area where the palm curves toward the small finger. Lightly run your fingertips along that outer ridge. Again, no pressure. You're not searching for pain or a lump. You're exploring for a line, ridge, or different sensation in the skin. Breathe in and out 3 times. Some people report feeling a slight ridge or a thin linear seam. Others describe a cooler quality of skin or a faint vibration. What you might feel here is related, in this map, to perception, the capacity to sense beyond surface appearances. Notice if your mental field eases or tightens as your hand rests there. Do skeptical or dismissive thoughts come up? If they do, treat them as noteworthy data. The pattern of interruption is present in the mind as well. Pause. Relax your hands. Give yourself a moment to note any after sensation. You might find that the hand feels slightly lighter or simply the same. Either way, you are learning to pay attention in a new register. Third location, the upper center of the chest, the externum. Place your hand, flat and relaxed, over the area just above the sternum, the notch and the soft area below it, in the hollow of the upper chest. Use the flat of your palm, not your fingertips, and keep pressure gentle. Breathe into that space. On the exhale, soften. Notice qualities like warmth, a spreading calm, a gentle pulsing, or nothing at all. In the Gnostic schema, this spot is associated with command or authority from within, the place that, when aligned, allows intention to be felt rather than merely thought. Some people report a radiance, a quiet clearing, or a slight hum. Others feel only an emotional swell, and for some, there is no immediate sensation. All of these are acceptable. After you remove your hand, sit quietly for a breath or 2 and observe what remains. Sometimes simply touching these places shifts the background noise, even if only minimally. Sometimes the most notable result is the mental reaction that follows. That mental reaction deserves a few moments of attention because it's predictable and telling. When you begin to check your body in this way, a stream of thoughts may arise: skepticism, dismissal, curiosity, or an argumentative impulse. These thoughts are normal. In the language we've been using, these are part of what the archontes do. They pull attention away from the felt sense and into a verbal, evaluative loop. If a thought appears, "This is nonsense," "I feel nothing," "This is dangerous," or "This is just placebo," do not take it as proof against your experience. Instead, notice it, label it briefly, thinking, and return to the sensation. Paradoxically, the presence of the skeptical thought can itself be a sign that an interruptive pattern is active. Many people find that their first instinct is to argue with their own sensations. The practice here is to notice the argument without getting pulled into it. If the suspicious mind becomes loud, use the breath as an anchor. Breathe in and release. Allow the breath to take your attention away from argument and back toward the body. Practice a gentle observer stance. You are the witness to whatever arises, whether sensation, image, thought, or memory. Avoid pushing for a specific result. Curiosity, not judgment, is the operative attitude. Now, to make the experience integrative, I'll offer a short activation declaration. This is not a magic formula or a guaranteed ticket to transformation. Think of it as a spoken orientation. A 3-line statement you can say aloud to help align intention, perception, and presence. Position your hands where you felt the most openness during the checks. Maybe both hands on your lap, one hand over your heart, or simply your hands rested comfortably. Speak each line clearly, softly, and with a measured breath between lines. The lines are: I remember my source. I open to clear perception. I stand in my own command. Say that aloud now, slowly, letting each line land in your body. Speak the first line and feel the base of the skull area you explored. Speak the second line and imagine the bridge of your perception across the lateral hand. Speak the third line and let it resonate in your chest. After you've spoken them, sit in silence and notice any shift. You may notice nothing, or you may notice subtle changes: a loosening of tension, a flicker of attention, the fading of an intrusive thought. All responses are valid. The declaration is meant to be a practical anchor that you can repeat anytime you want to reset. A word about interpretation. Don't turn this into a binary test. There is no pass-fail. Think of this as a gentle diagnostic, a way to start discerning the difference between a mind that is continuously hijacked by external frequency and a mind that can rest in quieter, interior registers. For some people, the practice alone, repeated over days or weeks, increases sensitivity. For others, the practice opens only small windows of clarity at first. That incremental shift is precisely how embodied awakening often unfolds: small, cumulative, and self-confirming. You may be wondering about resistance beyond the immediate skeptical thought. Often the broader systems of belief and identity, family expectations, social conditioning, institutional loyalties, reinforce the fog. You don't need to dismantle all of that at once. Start by cultivating a private competence, the capacity to check, to notice, and to hold your experience without self-judgment. Over time, such direct verification undermines the need to outsource spiritual authority entirely. That's the threatening element to centralized systems. It decentralizes verification. You don't have to give your power to any gatekeeper to know whether something is happening inside you. Let me offer a brief, practical protocol you can use in your daily life. It's short and repeatable. 1. When you wake or when you feel overwhelmed, take 3 grounding breaths and place a fingertip at the base of your skull for a moment. Notice anything different. 2. If you're in a meeting, in traffic, or about to react, touch the lateral edge of your hand softly. A micro reset to shift perception toward noticing rather than reacting. 3. Before making an important decision or expressing a firm intention, Rest a palm over your upper chest for a breath or two and speak a short line. I stand in my command. Then act. The goal is to create micro-habits that reconnect you to the felt sense of authority. Again, none of this is medical advice. If you live with anxiety, depression, or another clinical condition, integrate these practices with care and with professional support. They are meant to complement, not replace, sensible care. A brief historical caution. When I speak of these practices as linked to Nag Hammadi or the Gospel of Philip, I'm pointing to an historical current that favored interior verification. Those texts were marginalized for many reasons: political, social, theological. That marginalization doesn't automatically validate or invalidate their claims. What matters practically is whether the map helps you navigate your own interior. If it does, incorporate it. If it doesn't, put it down with grace and seek another route to embodied clarity. You may ask, if this interference is real, how deep does it go? The answer varies. For some, the block is situational, a life season of stress, trauma, or excessive external demands that drown out the quieter senses. For others, the block is habitual, patterned over years or generations. The more persistent the interference, the more consistent the embodied practice needs to be. Think of it like building a muscle: repetition, gentle patience, and kindness toward the parts of you that resist. If you notice strong reactivity when you attempt these checks, that reactivity itself is a guidepost, an invitation to be curious about the history of that reactivity, rather than trying to obliterate it. There is one more thing I want to name about community. Awakening is often described as an individual remembering, but it also happens in relationship. When many people independently discover similar markers and practices, a communal recognition emerges, a dispersed remembering of the same landscape. If you felt anything here that resonated, type recognition in the comments so others who are curious can find a signal. This is a safe way to begin connecting without creating dependency. Hold your experience privately and also allow it to be witnessed. The witness of others does not replace your own verification, it amplifies it. Before we close, let us acknowledge the ethical boundaries of this work. Do not use these practices to replace medical treatment. Do not push anyone to test themselves who feels unsafe. And above all, do not weaponize this language against others' beliefs or identities. The aim here is greater autonomy and clearer perception, not the creation of new dogma. If it feels appropriate for you, I'll offer a short prayer now. An invitation, not a prescription. Address it in whatever language fits your heart. Holy Source, whether named or unnamed, grant us courage to notice. Help us receive what our bodies say without fear and without haste. Guide us to act from clarity rather than reactivity. May we remember where we come from, meet what interrupts us with compassion, and move into deeper presence together. Amen. As you go about your day, return to these 3 places whenever you need a check-in. Keep a gentle curiosity about what changes. If you want guided activations like this, subscribe and press the bell so you'll be notified when we practice deeper sequences. There are more somatic tools, more contextual clarifications, and longer activations I'll share for those who want to continue. One final thought. Recognizing that something is blocking your spiritual awareness changes the conversation. It moves you from blaming yourself or waiting for an external authority to acknowledging an active pattern that can be watched, questioned, and worked with. This simple shift, from victim of opacity to investigator of your own experience, is the beginning of real agency. You are not alone in feeling the fog. You are not required to accept it. With small, steady practices, and with a community of witnesses who respect your autonomy, the fog becomes something you can learn to observe and, over time, to clear. Keep breathing. Keep noticing. Keep speaking the small truths that land in your body. That is how memory returns. That is how awareness reawakens.